Welcome to the channel. Today we look into fentanyl, a synthetic opioid, has dramatically altered the landscape of substance use and abuse in North America over the past decade. Like and subscribe for more video content. Its rise has resulted in a public health crisis marked by an unprecedented number of overdoses and deaths. This comprehensive overview will delve into the pharmacology, history, impact, and potential solutions related to fentanyl and its analogs. Fentanyl was first synthesized in 1960 by Paul Janssen, a Belgian chemist. It is a potent opioid analgesic, initially developed for medical use in managing severe pain, especially in cancer patients. The drug works by binding to the body's opioid receptors, which are found in areas of the brain that control pain and emotions. By binding to these receptors, fentanyl can significantly reduce the perception of pain and produce feelings of euphoria. One of the key features of fentanyl is its high lipid solubility, which allows it to cross the blood-brain barrier rapidly. This property makes fentanyl about 100 times more potent than morphine and 50 times more potent than heroin. The drug's rapid onset of action and powerful effects make it both highly effective for pain management and highly dangerous when misused. Fentanyl is used in several forms in medical settings, including as a transdermal patch, lozenge, injection, and nasal spray. It is primarily prescribed for managing severe pain in cancer patients and for use in anesthesia. Due to its potency, fentanyl is also employed in managing breakthrough pain, which is a sudden and severe spike in pain that occurs despite ongoing pain management. Despite its legitimate medical uses, fentanyl has become a major issue in the context of illicit drug use. The shift began in the early 2000s as efforts to combat prescription opioid abuse led to reduced availability of drugs like OxyContin. Users and dealers began turning to heroin, and eventually to synthetic opioids like fentanyl, which are cheaper and easier to produce. Illicitly manufactured fentanyl, IMF, is often mixed with other drugs, such as heroin, cocaine, and methamphetamine, unbeknownst to the user. This practice dramatically increases the risk of overdose because users are often unaware that they are consuming fentanyl, which is far more potent than the substances they believe they are using. The potency of fentanyl means that even a small amount can cause a fatal overdose. A lethal dose of fentanyl can be as little as 2 milligrams, equivalent to about 2 grains of salt. The increase in fentanyl-related overdoses has been staggering. In the United States, the number of overdose deaths involving synthetic opioids other than methadone, primarily fentanyl, increased from approximately 3,000 in 2013 to over 30,000 in 2018. By 2020, this number had risen to over 56,000. The fentanyl crisis has strained public health systems, emergency services, and communities. The rapid onset of overdose symptoms often requires immediate medical intervention, typically in the form of naloxone, Narcan, an opioid antagonist that can reverse the effects of an opioid overdose if administered in time. However, the high potency of fentanyl means that multiple doses of naloxone may be required to reverse an overdose. The crisis has also had profound social and economic impacts. Families and communities are devastated by the loss of life, and the economic burden includes healthcare costs, lost productivity, and the costs associated with law enforcement and emergency services. Compounding the problem is the emergence of fentanyl analogs, such as carfentanil, which is approximately 10,000 times more potent than morphine. These analogs are often even more dangerous than fentanyl itself. Carfentanil, for example, has been used as a tranquilizer for large animals like elephants, and is not intended for human use due to its extreme potency. Nevertheless, it has appeared in the illicit drug market, contributing to the surge in overdose deaths. Illicit fentanyl and its analogs are often produced in clandestine laboratories, with China being a major source of these substances. The raw materials or finished products are typically shipped to North America, where they are distributed and sold. Despite efforts by international law enforcement to crack down on the production and distribution of fentanyl, the illicit market continues to thrive due to the high demand and profitability. Addressing the fentanyl crisis requires a multifaceted approach that includes law enforcement, public health initiatives, and policy changes. Some of the key strategies include law enforcement and regulation, tightening regulations on the production and distribution of fentanyl and its analogs, international cooperation to track and dismantle illicit production networks, enhanced border security to intercept shipments of illicit drugs, public health interventions, increasing the availability of naloxone and training first responders, healthcare providers, and community members in its use. Expanding access to addiction treatment services, including medication-assisted treatment with drugs like methadone and buprenorphine. Implementing harm reduction strategies, such as supervised consumption sites where individuals can use drugs under medical supervision to prevent overdoses. Education and prevention. Public education campaigns to raise awareness about the dangers of fentanyl and the importance of safe prescribing practices. Prescription drug monitoring programs to prevent the overprescription and diversion of opioids. Programs targeting youth to prevent the initiation of drug use through education and community engagement. One controversial but potentially effective approach to reducing fentanyl-related harm is the establishment of supervised consumption sites, or SCS. These sites provide a safe space for individuals to use drugs under the supervision of medical professionals who can intervene in the event of an overdose. Additionally, SCS can offer access to addiction treatment, social services, and healthcare. Research has shown that SCS can reduce overdose deaths, decrease the spread of infectious diseases, and connect individuals with addiction treatment services. However, the implementation of SCS faces significant political and community resistance in many areas. Fentanyl's rise is part of the broader opioid crisis that has been building for decades. The crisis began in the 1990s with the overprescription of opioid painkillers like OxyContin, which led to widespread addiction. As regulations tightened and prescription opioids became harder to obtain, many individuals turned to heroin. The introduction of fentanyl into the illicit drug market has further exacerbated the crisis due to its potency and the high risk of overdose. Addressing the fentanyl crisis requires sustained effort and innovation across multiple sectors. It involves not only immediate responses to overdoses and addiction, but also long-term strategies to reduce the demand for opioids and improve pain management practices. Governments, healthcare providers, and communities must work together to develop comprehensive solutions that address the root causes of addiction, provide effective treatment and support, and reduce the availability of illicit opioids. This includes continued research into new treatments and interventions, as well as ongoing public education and prevention efforts. In conclusion, fentanyl represents a complex and multifaceted public health challenge. Its potency, ease of production, and the devastating impact on individuals and communities make it a top priority for policymakers, healthcare providers, and law enforcement. By understanding the factors driving the crisis and implementing comprehensive strategies to address it, there is hope for reducing the harm caused by fentanyl and improving the lives of those affected by opioid addiction.